that is going into clinical definitions. And one thing we say, there's always an opportunity for second opinion. All right? That is a provision you have by law. If you don't like what your doctor has told you, you're not comfortable, I will even encourage you, seek a second, third, fourth, fifth opinion. If 6 doctors agree and one person says the opposite, then really it's up to you to decide. But as I said, freedom of choice. And some of the technology that is available in Kenya privately may be way out of cost compared to going to these other countries. As I said, remember, these other countries, when you go there, you're going to a public, most of the time, public facility. So the cost is a public facility cost. It is definitely going to be cheaper for you there than it's going to be here. We go to India, we train in India, we see things Kenya does not have. All right? So you go and you're armed with the skills, and you come here, and it is a mountain to climb to convince the public facility to avail these facilities for you to be able to do these procedures. So what happens? If you don't practice your skill, you're going to lose it. Which still brings back the issue of having to go to the private facilities to practice there, because you get an opportunity to continue practicing your skills. A simple example is like our nurses. You know, in the West, you don't just have a nurse. A nurse is a specialized person in their field. So you'll find there what we call perfusionists, pulmonologists. These are nurses whose job specifically is in theater with the surgeons who are doing open heart surgery. Okay? Now, when you take in Kenya, we actually have 1 or 2 or 3 of those. We take them, we train them, we arm them with these skills. What do you want them to do? Do they come and rot with their skills? It's a waste of resources in the training aspect in the first place. So they have to seek an opportunity where they can be able to practice these things. The government needs to harness this skill and use it. And that's where the issue of redefining these facilities come in very handy. Because if you're going to undertake such high-level training, you need to arm these facilities to have these resources. A good example, Kisumu, our New Nyanza Provincial Hospital, is actually equipped to handle dialysis. It has a high dependency unit in it. It has no staff. Okay, so you have someone who has, who really wanted to help the society, put these things in place. There is no structure for ensuring that these things are available to the poor. So this person from Kisumu, when you give them the alternative to going to India, do you blame them for taking it?
Yeah. Looking at the way forward, because looks like so far there's a push and pull between the health workers and the government, the governors, and the people. Perhaps even right now as we're talking, somebody's actually close to dying.
True.
What is the way forward to that person? Of course, you spoke about the people should talk to their elected leaders, the governors, and ask, why is this health facility closed? What else should people do so that this strike is called off? It's the way forward.
Perennially when we have discussed issues of the healthcare, we have actually hoped that the citizenship would rise with us. Okay? I remember the very first time we went on strike because we were demanding for improvement of the healthcare sector in this country. As we demonstrated in town and sat outside the finance office, we had a lot of the public join us. And they sat down with us and said, you know what, I support your cause. All right? Now, this is a bit technical for them to understand that it is a constitutional or issue that we are addressing. So we don't expect them to come out, but we're trying in all manners to educate them that at the end of the day, we are no longer going to be able to point fingers and say, oh, Afia House has done this or done that or whatever. The governors have taken the responsibility. Let us see them asking that. A governor really is a CEO of a county. He is subject to the shareholders, and the shareholders are the voters who voted this person in. I expect them to rise up with us and say, this is not rocket science, and stubbornness isn't going to be the way forward. We are not against the Constitution. We are not against devolution. Let us do it right. And one of the phrases we have had is, as you have said, oh, what you're asking for is unconstitutional. I think breaking it down, you see that there is nothing unconstitutional we are asking for. So what we're saying is that, people, please, let us stop this impasse. It is that simple. Let us get these laws in order. And for us to have a reversal of that...
when you say laws in order, that cannot be done overnight. I think the reasonable thing you ask for Can that Gazette notice be cancelled?
That is what we are asking for. Cancel the Gazette notice.
Then go on
We
the process
have 3 good years to put laws in place.
If you talk about laws,
yes,
then people will think you are unreasonable. But if you say cancel the Gazette notice,
yes,
which was written in August,
yes,
then the status quo remains.
Status quo remains.
Then go ahead.
See, at that point, it is very easy for everybody to hold us accountable. You asked for time for laws. What are you doing about it? You know. And then we tell our people, we have the Ministry of Health, we have the Transitional Authority, we have the CIC, we have all these people who are on a payroll to make transition happen appropriately. Okay, let us devolve this service. It is an essential service to begin with. It is constitutionally looked at as an essential service. If you were going to devolve anything, what was the rush in rushing the one essential service without doing it right? When you had a period, you know, if we didn't have this transitional period of 3 years, then we would say maybe we are in a catch-22. Now we're saying you're wasting our first year. Then you will tell us we only have 2 more to go. Yes? So can we stop wasting time? Can we have this Gazette notice revoked? Can we have a fresh Gazette notice recentralizing this? Can we put our house in order? And that goes for all the various bodies or authorities that are responsible for this. If the parliamentarians sit in parliament and elect a health service committee, and it has done its assessment, and it has told you what you have done is wrong, so why then are they there? Their job is to advise. And if they come forward and make their recommendations saying, we have talked to the stakeholders, and this is not happening because of these hiccups, then what is so hard about them enacting the appropriate laws? Because what we know is that for any law to pass in this country, we need political goodwill. Yeah? So we need our politicians with us on this one. It's that simple. The Constitution is very categorical. The transition period allows for these things to be done in a proper manner, with proper structure and involvement of the public, the same public that is supposed to benefit from this devolution. So let's not turn devolution into an animal. And healthcare is not something we can afford to politicize. It is that simple.
What would be the negative consequence and the positive consequence of that gazettement?
As of now, there are no negative consequences. Okay? I mean, the only positive is that we have room to now work and put things in place. Okay? Because if you listen to the argument by the senators, what they are saying is that there is no law allowing for reversal of devolution. Okay? But the Constitution is made to serve man, not to hurt man. And you choose to interpret it the way you want. Okay? At the end of the day, if it was done wrong, then you cannot legalize the fact that since it has happened, you cannot reverse it. Because you should have looked at it, was it appropriately done? And I'm sure there's nowhere where the Constitution allows you to uphold it wrongly, isn't it? That it should be done properly. So I think that argument doesn't hold water. What we are saying is that we are running out of time to do things right. Let us stop all this political involvement. Let us just look at structures. Unfortunately, healthcare workers are not very good politicians. As we look at issues and want to address the issues, we're just requesting for a platform to have that.
And of course, you've spoken very well. In fact, a great deal of SMSs coming in here in favor of what you've spoken about. Just to read one here, the doctor has a point. I wish the government, governors, MPs and health workers could just talk and agree. It's only fair to stop devolving and put structures first in place for workers for the sake of patients. Final word, Waramateke.
I think they have a point. Like there are many
messages indeed.
If there is no negativity in gazetting that Gazette notice, I think it should be done. I mean, that's what they should do, and then start from there, rolling, asking those laws to be passed. I think that's what you're asking.
Yes.
That remove that Gazette notice of August, then start by writing or whatever the policy and all those things you are asking. Yeah. But if you ask for the law to be made now, before you go on strike, before you remove it, that cannot happen. But I get your point.
All right, many thanks indeed. Thank you so much for your questions and comments. We totally appreciate talking to Dr. Nelly Bosire, who is the Kenya Medical Practitioners and Dentists Union Nairobi Branch Chair. We'll be right back.